It's 2011. Watson, a computer built by IBM, walks onto the Jeopardy stage and annihilates the competition. Two of the show's greatest champions are no match for a machine that understands puns, nuance, and wordplay better than any previous artificial intelligence. This was a statement. IBM had built something extraordinary, and their next target was way, way bigger. Solve cancer.
If you think solving cancer is cool, then we're cool.
We believe that this is one of our big moonshots.
We will change and do our part to change the face of healthcare.
This is the story of Watson Health, a $4 billion moonshot that collapsed under its own ambition. A story that shows why AI is harder than most companies are willing to admit, and why hype in the wrong hands can actually be dangerous.
What is Watson?
In the early 2010s, IBM was a company in decline, not because it lacked talent or resources, but because its core business model was simply running out of time. Once the dominant name in computing, IBM had grown too dependent on legacy systems and service contracts. From 2012 to 2017, the company recorded 21 straight quarters of declining revenue. Two really big issues here: its hardware was commoditized and its consulting business was aging. Even as cloud and mobile were transforming tech, IBM was slipping into irrelevance. IBM thought it needed something to save itself, something to stop the bleeding and rebrand itself as an innovator. And although Watson's Jeopardy performance could be seen as a PR stunt, IBM seized on it as a symbol. Executives believed that Watson could be the basis of a new era, where IBM wouldn't just sell tech infrastructure but become the face of artificial intelligence. In healthcare, they believed was the ultimate proving ground, a $200 billion market with high stakes and deep complexity, and a problem that actually mattered. Not that Jeopardy doesn't matter. IBM poured billions into acquisitions, Truven Health Analytics, Merge Healthcare, Vital. Each one brought in massive quantities of patient data. IBM then partnered with Memorial Sloan Kettering, a top cancer center, to train Watson in oncology. And their ambition was absurd. Watson would replicate what world-class oncologists think and do it in a fraction of the time. They would have it read every clinical study ever written, analyze genetics, review your medical history, and give doctors a personalized, evidence-based treatment plan. It would take what only elite specialists could do and make it available to any doctor, anywhere. IBM positioned it as a symbol of the future. Watson would do for health what Google did for search. It ran glitzy ads with celebrities, TV spots showing Watson writing movie trailers and recipes. And inside IBM, optimism was sky high. One executive said Watson Health had thousands of employees and they expected it to generate tens of billions in revenue. From a business standpoint, if Watson could cure cancer, why not manage banks, predict supply chains, or optimize factories? But those on the project knew something was very wrong. By 2017, it was very clear that Watson wasn't generating real insights. At Memorial Sloan Kettering, Watson's treatment suggestions mirrored the training doctor's opinions, but it wasn't based off what it had learned, it was just mimicking. At MD Anderson, IBM spent over $60 million building a Watson-powered leukemia advisor. 4 years later, it was scrapped, never used on a single patient. An audit found basic goals unmet, and the system couldn't even integrate with the hospital's IT. Then came the most damning revelations. Leaked documents showed Watson recommending cancer treatments that were not only wrong, but dangerous. One internal test case showed Watson recommending a treatment that could have triggered severe bleeding in a patient with a known condition. So what was the core issue? Well, medical data is very messy. The big source of the data that IBM wanted for Watson was patient records, but they aren't as straightforward as you might think. Electronic medical records are built around billing and insurance, not science. The things medical research want to know about aren't always emphasized in what the insurance companies need. And to make matters worse, Watson offered confident answers even when it didn't have enough information to be confident. It didn't understand its own limitations, and in medicine that can be fatal. The Watson Health division never turned a profit and actually became a burden. Revenue kept falling and IBM's stock underperformed its peers. By 2021, IBM just gave up. It sold Watson Health data assets to a private equity firm for $1 billion, less than a quarter of what it had invested. Today, IBM is no longer chasing an all-knowing AI. Instead, it launched Watson X, a toolkit for companies to build their own AI models with a focus on privacy and compliance. And yes, they kept the Watson name. Ironically, just as IBM gave up on the project, health AI has actually been exploding. OpenAI's ChatGPT-4 and Google's MedPalm can answer complex medical questions, pass exams, and hold conversations that Watson could never dream of. These models learn from vast, messy data. Watson was simply too early. It was built in the era before deep learning really exploded. This channel breaks down how companies win and lose with AI, so we can identify things that others don't. If you found this video interesting and you'd like to see more on corporate tech in the future, please consider subscribing. This is Tyler Detchover. Thanks for watching.